All right. Welcome back, movement specialists, to another episode of Triplane Function, where we take a muscle, make it relevant to you so that you can see it, so you can feel it, so you can move it, so you can teach it. All right, today we're going to be doing part 2 of the hamstrings. If you haven't, go ahead and watch part 1. Quick recap. That part 1 taught us how we move those hamstrings so we can mobilize them from the bottom up, to where you can move your knee to get more of a stretch in the outside lateral aspect of the hamstrings versus the medial, or vice versa. If you need to, do a little bit of a refresher. Once again, the goal of our videos, like every single video, is where we take this TheraBand, where we have it overlay the muscles that we are highlighting for the day, so that you can feel it. This is not going to be an exercise with a TheraBand, but it'll heighten your awareness of what these muscles actually do. Okay, so let's real quick go back over the origin and insertion of these hamstrings. So, distally, let's go ahead and take that TheraBand and wrap it around your knee. Last time we talked about how that lateral aspect, biceps femoris, attaches to your fibular head. The medial aspect, your biceps tendinosus and membranosus, attach to the medial aspect of that tibia. Okay, now, since we're talking about top down, let's talk about a little bit more about this proximal attachment. Steve, go ahead and face that way. This proximal attachment, once again, is going to be the ischial tube. That was a partial truth I told you. This biceps femoris, biceps, two heads, just like biceps. There's also another attachment to this lateral aspect of the femur as well. So you will feel this a little bit more if you especially get it a little bit more laterally if we're highlighting that biceps femoris. Okay, so typically people that have more high hamstring injuries might be more like your ballet dancers, your kickers in football, where they might have that high hamstring pull and pain. A lot of times we tell those people if we need to have them stretch and stretch at all, a lot of people say, oh, just forward flexion, just go ahead and bend over. I don't know, that doesn't look like too much like ballet or kicking to me. If you're teaching this to some sort of lifter, which soon I'll show you how these hamstrings are important for stability with someone that squats heavy, do we want them to teach them how to anteriorly tilt their pelvis like this, lumbar lordosis, to stretch their hamstrings? Probably not an authentic way to get these hamstrings more mobilized. So once again, let's go ahead and return to the position we were in the last time on Steve's knee. So Steve, let's go kneel down here on your left knee. Okay, and we'll go ahead and just keep your foot just straight forward, because we're talking about top down, where we can move the chest here to alter your different stretches. So in the sagittal plane, Steve can just flex forward here, and I would even say for him, Steve, keep your chest up and go ahead and just flex forward from your hips, more from axis here. So keep your chest up, look at the video, good. Heel, where do you feel this, Steve?
The lateral aspect.
More the lateral aspect. Not surprising, last video we saw this lateral aspect was a little bit more tight than its medial aspect. That's just sagittal plane. We kind of know this intuitively. How do we manipulate in the frontal plane going top down? Well, if we want to load up this lateral aspect even more, I'd say, Steve, go ahead and bump out your hips towards me. Up, keep that chest down forward. You can see that he just popped up right away. That's how tight he is on this lateral aspect. Do you feel it more out here, Steve?
I cheated with my leg.
So he's cheating, but that's okay. That's okay. And now he'll feel it even more. Now, if he bumps out the other way, he'll feel this more medial. You'll see that this lateral aspect, this TheraBand gets a little bit looser. This medial aspect TheraBand gets a little bit more taut. You should feel that in the underlying muscle as well. If you need to, if Steve had the stability, I'd say you can even use your hand, have it come over just like this. And he really might not like me here. Oh, well, I'll hold this right here for you, Steve. Go ahead and lift up all the way up and overhead here to where he gets that more of the lateral aspect as well. So this is really taking this top-down strategy in the frontal plane to get more of a load of the medial or lateral aspect of these hamstrings. This might be really relevant for someone that squats heavy, and you see them as they squat down low, they might deviate their butt to one side. Is that just butt weakness on one side? It could be. It could be a host of things. Have you ever thought about looking and checking into asymmetry in the mobility of these hamstrings? You can see that Steve, since he's so tight right here, he might be one of those guys to deviate to the right if you squat really low. So think about that for those heavy lifters, for those squatters. Okay, so that was frontal plane top down. Now how about this transverse plane top down? Let's go ahead, Steve, let's have you twist all the way over here. As you do this, you'll see that he's taking that ischial tuberosity, twisting it to the right, further away from this fibular head. This should be stretching the lateral aspect more. Steve, where do you feel this? The lateral aspect, this biceps femoris. This will shorten this medial aspect a little bit. So, what if we have him twist the other way? What do you think is going to happen? Exact opposite. Now he got his ischial tuberosity spinning toward his fibular head. This will shorten this lateral aspect. It'll lengthen this medial aspect. Perfect. Who is this relevant for? Think about that basketball player. After he dribbles, he stops. He has the ball. He's got to twist, guard the ball out of the way. Do his hips, do his hamstrings have that kind of mobility to help him with that? Now Steve right here, I'd love to push him a little bit more. He might be feeling a little bit more unstable, so I'm going to be nice to him. Because sometimes in order to get more mobility in someone, you have to give them some stability. So Steve, just go ahead and reach his left hand all the way over here so you can really feel that twist up in that transverse plane. Now just like what we talked about in the last video, you don't have to just take these planes of motion piece by piece. You can combine them. So for this lateral aspect, for Steve, which is tight, we're already winding him up from the top down laterally here. We said also in the frontal plane, if we bring his hips out here, bump out towards me, you'll feel this more laterally. Steve, are you feeling it?
Yes.
And we just manipulated him top down. If you need to, we go back, watch hamstring video part 1 to see how we manipulate bottom up. And Steve is going to feel the biggest biceps femoris stretch of his life, because now I'm going to take his foot, I'm going to adduct it if he's going to let me, internally rotate it, and you see how he just cheated completely out of that. Steve, come on, buddy, come on. Okay, twist that way. Keep your hand there. Butt out right there. Okay, this is a huge stretch. Now, go ahead and relax out of that pain face. How's the pain face, Steve? How's it nice? Oh. Effective, especially if you're dealing with someone with any kind of upper hamstring injury, even things like an ischial bursitis, something like a high up adductor strain, people that have femoral acetabular impingement. This is going to be especially relevant to them, especially those heavy lifting athletes, those pivoting athletes. Hamstrings are used by everyone. Random factoid of the day, it's one of the only muscles that has a verb associated with it. If you're in a group and you did something bad for that group, they would say, hey, Andrew hamstrung me in that group. He didn't pull his own weight. Our group is now hamstrung. That means, hamstring actually means to render useless. If you hamstrung anyone, that's not a good thing. If you don't know how to mobilize these hamstrings, if you don't know how to use these hamstrings, you could also be rendering yourself useless as your own movement specialist. You might even not be doing the best benefit to your patients, to your clients. So take these hamstrings, know how you can manipulate from the bottom up. See how you can manipulate them from the top down. Combine those motions, combine those planes. Soon you're going to find that stretch that's going to give that look, that pain face that Steve gave us, and the best hamstring stretch he's ever felt in his entire life. Thank you, movement specialists. Tune in next time for another episode of Triplane Function. Thank you.